Hi, this is Divya, Assistant Professor of Biomedical Engineering Department in SNS College of Technology. In this video, we are going to see about the medical monitoring system. Okay, this is a wearable device course, and in this course, we are going to see about the medical monitoring system, how the medical monitoring takes place in different aspects. Okay. Medical diagnostic in applications of wearable systems. How does the medical diagnostic takes place? See, as we all know that we have medical issues then and there in our daily life. Okay, how we are going to monitor it and diagnose it then by there using these wearable systems. Okay. First, what we have is that wearable systems a continuous health tracking, a system which continuously tracks the healthcare in a daily life. Okay, in a daily basis, in a minute basis, hour basis, we can according to the application needed, we can divide it accordingly. Fine, and then the real-time data. See the vital parameters like the heart rate monitoring, glucose monitoring, blood sugar rate, and these are the vital parameters. Blood sugar, blood pressure, and all these are the vital parameters which can be monitored daily in daily basis. Okay, and in the real time data, then at a present time, we can monitor how the pressure of the patient is and how the sugar level of the patient is. That is called the real-time data collection and analysis. Collecting the real-time data and analyzing it, how it is, whether it is in the higher level or in the lower level. Okay, and next is anomaly detection. Monitoring vital parameters. That is the thing what I told already. Monitoring vital parameters. These are real-time monitoring of data. Is that if we have any other issues other than the vital parameter data. Anomaly detection is that monitoring vital signals. Since we go to the hospital, right, this vital parameters will be initially identified how the patient is. By identifying these vital parameters, and then the doctors goes into the other procedure, right? Next is the timely interventions. If there is an emergency, in that case, facilitating a proactive care. Then we go for the doctor or a clinicist where we go for the further treatment. Right? First is the wearable system which continuously tracks the healthcare. And next is the real-time data where we can collect the data and analyze the data in a real time. Next is the anomaly detection where the vital signals can be monitored there by there. And fourth one is the timely interventions. If there is an emergency, then we can facilitate it to a proactive care where the doctors can check the patient whether they are in a critical position or not. Okay, these are the 4 stages where the medical diagnostic wearable system revolutionary takes place in a medical diagnosis. Next is the wearable revolution in healthcare. This is generally how the medical wearable revolution in the healthcare. How advanced it is, what kind of technologies it has been incorporated in it, and how it is very helpful for the patients, and what all the technologies it has to be incorporated thereby in future. These are the things where the healthcare system has revolutioned in the wearable technologies. Okay, the global healthcare challenges. How does the challenge takes place, and how does the World Health Organization is going to meet and these healthcare systems. Okay, chronic diseases account for 75% of all deaths worldwide according to WHO, creating an urgent need for continuous patient monitoring beyond traditional clinical settings. What the global health challenge is going to tell about is that the World Health Organization has a has a status that 75% of the patients are dead because of there is a no immediate care or immediate treatment for the patients. Since there is no continuous patient monitoring, the patient will not be able to go to the hospital then and there. So they just leave the disease what they have, and they ignore the symptoms what they occur or they feel. In that stage, what is going to happen is that 75% of death state occurs. That is what the World Health Organization tells. And then the real-time intelligence. How does the real-time intelligence takes place in this? Wearable systems enables non-invasive real-time tracking of vital signals and physiological data, transforming reactive healthcare into proactive wellness management. Okay, this real-time intelligence helps in identifying the real-time vital signals in a real time, and then the physiological data can also be collected, and it acts according to the data which is in a normal range, that can be avoided, and if it is in the abnormal range, then it can be taken into an account, and it will be it can be treated accordingly. This is the real time intelligence. Next is technology leap. From bulky laboratory equipment to skin like flexible sensors. We have in past we'll be having a bulky laboratory equipment to analyze the patient, whether the heart rate, how does the heart rate is, and how is the blood pressure is. And now we can see how the changes has been done in a single equipment. For example, we can take this BP machine, right? This previously will be able to identify only the blood pressure by using by pumping the air pressure by using our hand. But after that, now we can check. We have in a single equipment we can check the BP, the height of the patient, weight of the patient, and all those things. Okay, likewise, the system has been changed. The devices has been developed to analyze different parameters in the human body. Okay, where the witnesses or remarkable transformation in medical devices, miniaturizing and comfort, where the size of the device is also miniaturized, very small, and it is very comfort for the patients also. That is the thing where the wearable revolutionary in healthcare has been developed. Okay, unveiling the impact of wearables on healthcare. What I told is mentioned here. Enhancing patient outcomes. How does the patient's outcome has been done? And then first we are going to real-time health monitoring. Real-time health monitoring should be done, and then the early health issues to be detected. First the real-time monitoring to be done, and then early health issues will be detected, and then enhanced patients' outcomes. And what we are going to do is personalized health insights should be given. Real-time first we are going to do is real-time health monitoring, and then what we are going to do is personalized health insights should be given. How the patient should behave, and what all the medicines to be taken, that should be given. And then early detection of the issues. For that, what we are going to do is personalized medicines. Since they are detected by some disease, the personalized medicines should be given. By combining all these things, the patient's outcome will be developed. This is the thing where the wearable device is revolutionary in healthcare. Thank you.